Welcome to the SCI Chatroom. It's a platform where we discuss matters that are relevant to daily living. On today's episode, we'll be looking at some of the important things you must know about COVID-19, from self-care to vaccination. Today's discussion promises to be insightful, so please invite friends to watch with you, or better still, host a watch party if you're on Facebook. COVID-19 has really changed our lives, and it continues to impact our lives in profound ways. And for me, the scary thing is the uncertainty around how long COVID is going to be with us. Turn on the news and 90% of the time is about COVID. Statistics on people who have sadly lost their loved ones to this pandemic. Put C in the Google search bar, and the first word that comes up is COVID-19. That's interesting. This shows how much COVID has infiltrated our world. So it's important for us to have the right information on how to protect ourselves and our families from this deadly virus. We are privileged to have two medical doctors with us who will be educating us on the topic. Also joining me for the discussion is my usual co-host, Shinge. Welcome to the chat room, Dr. Okori, Dr. Michael Okori.
Thank you, Margaret. Thank you very much. Thank you.
Thanks for being here. It's a privilege to have you. Welcome to the chat room, Dr. Patience Okori.
Thank you, Margaret. Thank you, Shingi.
Thank you for coming. It's good to have you. Before we start the discussion, I'm sure our viewers would like to know your profile. So is it okay if you don't mind to introduce yourself to our viewers?
You go first.
Ladies first.
I'm Dr. Patience Okori, and I work in the NHS. I'm a GP, which means I'm a general practitioner, and I work in the community. Used to be a pediatrician, so I still have a special interest in pediatrics and women's health. I also work for the clinical commissioning group at the Sussex CCG. So I'm a clinical director with the West Sussex CCG, and also a clinical lead for children and maternity services across West Sussex. Also the clinical lead for medicine management in Crawley. So this is what I do, apart from looking after a family when I'm not doing all of these other things. Thank you.
Wow, it's a rich experience. Thank you so much. You are in for a treat. Yeah. I'll come back to you now, Dr. Michael.
Thanks. Okay, so I'm Michael Corey, and in fact, my biggest responsibility is that of a dad and a husband. So I've got to declare that first. Secondly, I'm a consultant physician at Brighton and Sussex University Hospitals. My specialty background is in clinical pharmacology and therapeutics, and essentially what that means is a doctor who is meant to know a lot about drugs and how they're used in clinical practice. I run the hypertension service, so high blood pressure service in Brighton. I'm also a general medic in the sense that I have ward inpatients who have different diseases, including COVID-19. I'm also an academic, so I teach in the medical school, the Brighton Sussex Medical School, and I'm also involved in research. The other role I have is that of the Associate Medical Director of Medicine Safety and Prescribing at Brighton and Sussex University Hospitals. I have also been involved directly with setting up our vaccine program in the hospital. We were one of the 6 first UK hospitals that were vaccinating people, and have come across different scenarios, especially with regards to the COVID-19 vaccine. Thank you.
Amazing. Thank you so much. There's a lot of misconception about the vaccination, so thank you for coming here to shed more light on it for us. Thank you. In as much as there is a pandemic in the world, there is also a lot of information out there. And to be honest, for people like us who are not in the medical field, like me, who is not in the medical, Shindi's in the medical field, so it can be quite overwhelming and confusing. And so it's good that you have taken the time, because we know you're very busy. So thank you once again for taking time off your busy schedules to be with us, to educate our viewers, and to educate us as well on some of these important topics that are affecting us in life. The first thing I want us to talk about is what symptoms should people look out for, and what are some of the practical steps we can take to protect ourselves and our families from COVID-19?
So I'm going to go for that because obviously because I work in primary care, as I said, so most of the first contact sometimes could be the GP. So the symptoms they're actually a range of symptoms. Some people actually have come back to us saying, I didn't really feel unwell at all, but I lost the sense of taste. So they couldn't taste anything, and some people haven't smelled anything. But the commonest symptoms are usually that of fever, a cough, generalized aches and pain, and also just not feeling well, just feeling tired. So it could range from people not feeling unwell to those who have quite severe symptoms with cough and feeling breathless. So these are the symptoms.
Just to add, so the cough is any cough that is unusual for you. You know, so some people are drinking water and they all of a sudden start coughing. It's not that sort of a cough. It's an unusual cough that, in fact, the way they describe it, a cough that has gone on for an hour. You know, how can you be coughing for an hour? Or you have coughing episodes more frequently, 3 times every 24 hours. You know, so essentially it's an unusual or new cough. Unusual new cough. Some people, by virtue of their background history, coughing is part of their illness or part of their general health. So it has to be a new cough. Obviously with that, if it becomes more severe, shortness of breath is something to look out for, because that may well indicate that you need to be in hospital rather than, you know, still continue to be in your own home.
Okay. So with regards to shortness of breath, it's not when you've been running and then you're running out of breath, you come to your GP and say it has to be something that's all of a sudden, or when you've not been doing anything excessive, I'm guessing.
If you have a reason to be short of breath, not what is, as you said, running for a bus or running after children, you know, or going up and down the stairs 100 times, you know, that's a reason to be short of breath. But if normally you wouldn't be short of breath and you are short of breath, then that's something, it's a worrying symptom. And you do need, you know, medical attention.
Here in the UK in particular, especially with the second wave that we have experienced, there has been COVID that has been picked up in children, and a lot of the times it's been asymptomatic. Have you noticed anything as from the medical side whether children exhibit any symptoms of COVID?
I think, as you rightly said, excuse me, in the first wave, we didn't really have a lot of children, and obviously there was not a lot of testing going on as well at the beginning of this pandemic. In this second wave, a lot of people are being tested. So we've seen children who have had COVID, and most of them also will be a fever, a sore throat. But what has been common, what is common in the hospital that has been noticed is the fact that children who have come in with other things, like other infections, or they have a urinary tract infection or a chest infection, had tested positive to COVID. So they were not being admitted because they had COVID, but they've come in with other things. So it's similar symptoms: cough, sore throat, fever. That's also still the commonest symptoms. But children are not very unwell with COVID-19. That's the general thing that has been noticed.
And the truth is, we don't know enough what is going on in various groups, particularly in children. But what we can say is that they tend to have a milder infection. They tend to be more likely to be asymptomatic. And that is the case for a lot of the other viruses as well, you know, not just the COVID-19 virus, the coronavirus, you know, a lot of the other respiratory viruses, as they're called, you know. So in children, yes, milder illness, much less risk of coming to serious harm. The only issue is a lot of the treatments that are being developed and the vaccines, children might not have been included in the trials. So the data, there's a gap in terms of the information we have, but from what we know now, they're less likely to suffer from severe disease and more likely to have no symptoms.
Thank you.
Thank you. I guess it's good in a sense that children are not as much impacted as adults, because when children are careless or carefree, if I should use that word, I take my son to nursery and there is no way you can tell a child to social distance. So in a way, I guess it's good, but we're hoping that things get better. Thank you so
Yeah.
much. And following on from that question, what are some of the practical steps we can take to protect ourselves from COVID-19?
Okay.
Yeah. Well, I think as we've been told from the beginning, and even more emphasis now, it's all the practical things we can do as individuals, which starts from social distancing, um, personal protective equipment for us, like this face mask, washing our hands, using alcohol gel when you're not able to wash your hands immediately or even after washing your hands. But most of all, promptly testing ourselves to know if people feel unwell, to be able to detect whether they have COVID-19 and isolate themselves. Um, as well, limiting social contacts, because that's the main reason for this lockdown. And I think it's one of the things that people didn't realize early, that people could be asymptomatic and still transmit this infection. So if life carried on as normal, where you visit other people, go to parties, then you're likely to pick up infections from people who are asymptomatic, or actually yourself, if you're asymptomatic, would transmit this infection. So these are all the things we need to do. And Michael might be able to add more if I've missed out anything.
I mean, the problem with COVID-19 is that the way to reduce the risk of transmitting it or spreading it is countercultural. So as human beings, we're social beings. We like hugging, we like coming together, we like spending time with each other. But, you know, unfortunately, all of those things that we would do normally help to spread the illness. And the more it spreads, the more the people will suffer, you know, harmful effects from it. So as Patience has said, you know, unfortunately, minimization of social contact and trying to be cautious, you know, in the ways that she's mentioned are the way to go. The other thing to be very conscious of is if you do develop any of the symptoms we talked about at the beginning of potential symptoms of COVID, the instruction is that you isolate, you self-isolate. And it's not just you that will isolate, it's your whole household. So in doing that, you know, until you have tests to determine whether, you know, it is COVID-19 or not, what you're trying to do there is minimize the risk of spreading the illness, you know. So the first thing, if you do develop symptoms or someone around you in your bubble or immediate vicinity develops symptoms, you've got to isolate until testing occurs, you know. So it's quite important. It's not every fever is COVID-19. Not every cough is COVID-19. So, but until because there is a high risk of having these things, these symptoms with COVID-19, until you know for certain, you've got to isolate in order to minimize that transmission, because if not, you know, it will just be transmitted to many other people.
And that just leads us on very nicely to our next question. And this is mainly focused on our UK viewers. So could you shed a little bit of light on the NHS test and trace process and why it's so important in minimizing the spread of COVID?
So the test and trace system is based on the principle that if you identify and isolate individuals who have COVID-19, you may reduce the risk of spreading the disease, therefore reducing the impact on the general population. So you know, in the UK, and it's probably like this for many other countries around the world, and they approach it slightly differently. If you develop symptoms, or it needs to be reported after you've isolated yourself. And then what the NHS test and trace app will do, or program will do, is to identify potential contacts, people who have potentially been in close contact with you. And what they will do is they will notify all of those individuals, which is why, you know, the barcode they get us to scan when you're going into a particular place is quite important, because you know, they say garbage in, garbage out. If we don't feed the test and trace system with the right amount of information, the output is not going to help us. So it's dependent on the number of people who either report symptoms and get tested, or the number of pickups, so that the NHS themselves or the health service can ask people who are potentially in contact with index cases, if you like, to isolate until they know what is going on. And that reduces the risk of spread. So it's almost like isolating individuals and reducing the risk of individuals who may well be incubating the virus. Incubation means that the virus is growing, it's reproducing in your body and may not necessarily have caused symptoms. And I'm sure we'll go on to talking about the incubation and how it presents and the number of days. But the whole idea is to try and isolate people so that the spread can stop. So even if the index case does have COVID-19 and it's confirmed, people who have been in close contact with them, they need to isolate until the full incubation period has elapsed. And then only then will the individual be safe to continue to associate with people, within the limits of the safety measures that patients mentioned before. I don't know whether you want to add.
Yeah, so just the process of getting tested in the UK, because we've seen a few patients who just stay at home and they phone you and say, I didn't feel very well, I think I have a cold. And you say, have you tested? Say, oh, well, I didn't know what to do. So you could test via the 111 app, 111 app. So if you key into any mobile phone now, COVID testing, it will take you to a government website and you'll be able to click on book a test, and you go through a few questions that you'll be asked, and they either would post a self-testing kit to your address, or for some people who are not able to take these samples themselves, they will be invited to a test center. If you can't do that on a mobile phone, people are able to call 119. That's another way of getting tested. If you call 119, then they will go through it and might be able to book a test. But if all of these fail, or you're not able to do any of this, you can definitely contact your GP, who would be able to go through other ways of getting yourself tested. But it's so easy to get tested. So you need to book the test, stay at home, wait for the result. And if there's more than one person in the household, they also get tested. But the other contacts who you've been in touch with prior to feeling unwell are the people who are going to be told to be isolated as well. But the people in the household will be tested and they would have to stay at home. No one goes out from that point until you have the result.
So this program, Test and Trace, will fail if you develop symptoms and you do not report, so you're not tested, or you come into contact with any public facility and you don't register the fact that you've been there, if there's an opportunity to do so. So it will not work. So the more people test with symptoms and the more people self-isolate, the better it will be in terms of trying to keep the disease at bay. And it's quite important. I hope we go on to talk about the incubation and the reason for testing and tracing and self-isolating and the period of time. But it's really important that people who have symptoms, even if you think, even people like me who are very reluctant to, sort of accept weakness. A dry cough before COVID, that is. Now, I would go for a test, or I'll self-isolate first. Before COVID, if I had a cough, who cares? I'll walk around, I'll do whatever I want to do. As long as that illness has not kept me in bed, I will continue to go to work and so on. But now that there's COVID, even no matter how minor the symptoms are, as long as it is a new symptom, ones we mentioned earlier, a new cough, fever, loss of taste, loss of smell, even some other minor symptoms that you're not entirely sure of, it's best to isolate and test it, because there is a risk of you having COVID.
I think one question I have around this is, so if you develop the symptoms, how many days do you have to wait to get tested? Or do you have to get tested straight away when you sort of notice that you've developed symptoms?
Maggie, straight away, yeah. The day you feel unwell with anything at all is the day to make contacts to get tested. There's no point waiting, because at the moment, as Michael rightly said, if you're unwell, one of the first things that comes to mind is have I got COVID-19? And anyone could have it until proven otherwise. So yes, straight away.
And the in fact, if you delay up till about, you say, a week or 8 days after the onset of symptoms, you may go in for the test and it'll be negative. So in fact, in Scotland, I am aware that in fact they say test within 5 days. You know, you've got within 5 days of the onset of symptoms. So the message is you test as soon as you develop those symptoms, or you make inquiries to test. It may well take 1 or 2 days to get you tested, but you test as soon as you develop those symptoms, because the more you delay, the greater the possibility of a negative test, and we may never know. And that's the danger.
And so just following on from that, because you've brought up some really interesting points of the importance that for the test and trace system to work, we all need to make sure that we use it and we self-isolate. And then you've just talked about how soon we need to get tested. So can we follow on and talk about, as you've mentioned before, Dr. Michael Okori, the incubation period of COVID, and why it's so important for us to get tested within those 5 days. And I've heard as well that if you have the test after 10 days or 2 weeks, sometimes you can still show positive for COVID, even though your symptoms you've completely recovered. So may you give us a little bit of insight on that?
Yeah, so the incubation, when we talk about incubation period of a virus or an organism, a living organism, it's essentially the time for the organism to reproduce sufficiently to be able to cause disease. So the reason for asking contacts of people who have symptoms of COVID to self-isolate is because even though the people who've come into contact with the individual who has symptoms may not have any symptoms at all, in fact, they may be going about their normal business, not unwell at all, it is possible that the virus is reproducing in their bodies without them knowing it. But the danger is you feel well, you go out, the virus is reproducing, you may be at risk of actually spreading it even before the onset of symptoms. Now, on the average, it takes about 5 to 6 days for the COVID virus to incubate sufficiently to be able to cause symptoms, but can take up to 14 days. And actually, the most recent data suggests that 10 days is probably a good cutoff, a decent cutoff. Now, this is the reason for that 10-day isolation period for COVID-19, following a history of contact. And that's to cater for a complete incubation period of the virus, after which, if within 10 days you don't have symptoms, it's unlikely, it doesn't mean it's not a definite, it's unlikely that you have COVID-19 that you'll be able to spread to other people. Okay, so it reduces the risks. So the isolation period, the time for testing takes into account the incubation period, which is the time for the virus to reproduce sufficiently in sufficient numbers to be able to cause disease. Do you have any?
Yeah, that's it.
Thank you so much. This is eye-opening for us all. So we're moving on to the next point of discussion, which I believe, Dr. Michael, you'll be interested in. So why is it important for people to get vaccinated if they qualify for it? Are there any medically proven side effects, and also an insight on some of the approved vaccines that are used in the UK or even in the world will be good.
Okay, so vaccination. So when COVID started, the problem with viruses is that they're very small, and a lot of the treatments we have do not work. They're just too small for the treatments we have to work. And this is the fundamental problem with viral infections generally. Now, with COVID-19, the initial treatments that we looked at, they didn't cure the disease. They maybe reduced the risk of going onto intensive care unit. They reduced the risk of very severe disease, but there's still no cure for COVID-19. The disease, the drugs we have that are being used, particularly in hospital, all they do is reduce the risk of someone going on to intensive care unit or severe disease. Those are the treatments we have. So the only way around trying to control this disease is by vaccination. And vaccination is essentially a process of trying to train the body to develop its own response to the virus. So this virus is really small, And actually the most efficient mechanism for getting rid of the virus is your own body defenses. So vaccines are one way of trying to stimulate your body's defenses, it's called the immune system, to be able to attack the virus with a view to neutralizing it and to keep you better. And that's the whole principle the vaccines are based upon. Now, vaccines have been around for a long, long time. And some of you will be familiar with, smallpox vaccine for measles, mumps and rubella, chickenpox vaccine. There are all sorts of vaccines, that are available. And the way they work is that they stimulate the body's defenses to attack the disease. Now, in the case of COVID, obviously, time was of the essence. We had no treatments. This was a condition that could spread like wildfire. It can cause severe disease in particular groups, and I'm sure we'll talk about that a bit later. So we were, sort of stuck. And the only, sort of response the research community had was to try and develop a vaccine very, very quickly. Now, the process of vaccine development normally takes time. Okay, so it involves clinical trials where you develop a vaccine, which is, oftentimes a substance or even a smaller dose of the disease, and you give it to people under clinical trial conditions to see whether they respond to it or not, whether it protects them from disease or not. In the case of COVID, we couldn't actually wait for very long, because this was a disease that was wiping out quite a number of people. Lots of people were dying from. So what then happened is that the medical research community, in partnership with government and the pharmaceutical industry, what they did was they went into huge partnerships and day and night spent time, day and night. I'm telling you this because, knowing, a bit about how things happen, day and night, they worked to try and get a vaccine developed in a record time, And thankfully, even though the virus started in Wuhan, the COVID-19 started in Wuhan in December of 2019, thankfully, by December of 2020, the first vaccines that were produced were beginning to be administered into a UK population to start with, but that's now gone all over the world. So important to I need to emphasize the fact that vaccines are the only way to curtail or to control the disease, okay? Because we have no curative treatments. There's no cure for COVID. The cure is your body's defenses. And the only way to assure that is by giving the vaccine. Now, there are a number of vaccines that have been in development. So far in the UK, there are 2 in use. One more has been licensed. It's not yet in clinical use. And there's a further one that is undergoing the licensing process. Now, to license a drug, in the UK, this organization is called the MHRA. It's a regulator. And this is to license any treatment at all, any medical treatment. They have to look at the information, have to look at the clinical trial information, and make an informed decision on whether this is safe for human use, or whether this is effective for human use, and so on. So the vaccine was had to be exposed to such a rigorous process. Now, because they've spent day and night doing this, because time was of the essence, it's come out in record time. Now, that doesn't mean it didn't go through the normal channels. It did. Just like any other vaccine, just like any other treatment, it went through all the normal channels. And in the UK, we've got 2 that are in clinical use. And those 2 are in clinical trials, have been shown to be very effective in reducing the risk of development of the disease. Okay, so, going into numbers is slightly too simplistic, but, the summary and the message is that the 2 vaccines that are in clinical use in the UK are effective in reducing the risk of COVID-19. Okay, so no treatment is 100% effective because it will not work in 100% of people, but in majority of people, from the clinical trial data, we can confidently say that they are effective in reducing the risk of, severe disease or dying from COVID-19. I don't know whether you want to say anything more about the intricacies or later.
I think, Michael, it was good that you gave that question to Michael, because he's been involved in research and also he's a clinical pharmacologist. As he rightly said, any medication, any drug, any vaccine that is going to be licensed for use in people has had to go through rigorous testing and certification. So the fact that this came out in record time, as I said, doesn't mean that it hasn't gone through all these processes. So it's gone through these processes, it's been found to be effective and safe. And this is why it's been rolled out to the population. Michael, you want to mention the names of these vaccines?
That was my next question, actually.
Yeah.
And some side effects as well.
Yeah, because I've been vaccinating people and they turn up and they say, and I say to them, you're having this, they know already, what vaccines am I having today? Is it the Oxford? Is it the Pfizer? So I'm going to leave that other question for Michael to go through all the names of these vaccines.
So there are over 10 vaccines that are in development all over the world, But I said that currently in the UK, 3 have been licensed, 2 are in clinical use, which I'm going to mention now, the ones that we're using right now. The third one that's been licensed will probably get stock in April or sometime around then. And then there's a 4th one that's being in development in the UK that is going through the regulatory processes. But as I said, there are many more vaccines that are being developed in different parts of the world. So the 2 that we used in the UK, the first one was the Pfizer-BioNTech vaccine. So this is this was the very first vaccine used for COVID-19, and the very first individuals that were sort of injected were in the UK, but it's now available in many other countries. And the Pfizer-BioNTech vaccine is a vaccine that is, probably the first of its kind in terms of vaccine, in the sense that it's called an mRNA vaccine. Now, essentially, in very simple terms, what that means is it utilizes a protein, like the protein we eat, but, very small molecules, small amounts of a protein that can signal to the body that this is a protein that is similar to the virus that causes disease. So even though it's not the virus, it's made in such a way that it's a process that it's a protein that signals to the body that this is something that is carrying information, that is information similar to what the virus utilizes to infect the cells, of the body and cause disease. So by doing that, the Pfizer-BioNTech vaccine is able to stimulate the body's defenses to be able to attack the virus. It's called the spike protein. That's the bit of the virus that is the problem. That causes disease because it's to penetrate the cells of the body and cause disease in various organs. So if we have a substance that can tell the body that, look, get ready for this viral infection because this is how it causes damage by means of the spike protein, then we're home and dry. And that's exactly what happened with Pfizer-BioNTech. And that's how it works. The second vaccine is the AstraZeneca Oxford vaccine, which came online a bit later. It's not an mRNA vaccine. It's a slightly different type of vaccine in the sense that they've tried to look at similar viruses, and by a process of genetic engineering, they've managed to get the body to recognize the body's own, the spike protein, which is the problem with the virus. Now, again, it doesn't utilize the virus itself. So you can understand why when people say to you, it's unlikely that that any of the vaccines can cause COVID themselves. It doesn't utilize the virus. It merely either I was going to use mimics, but it's a term we use in medicine a lot. It copies, if you like, what the virus utilizes to cause damage. And that's what the 2 vaccines are based upon. And they're based upon the principle that if the body recognizes that this is something that looks like the spike protein. It will develop immunity, which is your body defenses. And then if the virus itself attacks, it has no chance in the body. And that's how the vaccines actually work. But Baby, you might want to tell them how we give it and how it's administered.
Yeah, just before I say that, I just want to add something, because obviously I've seen a few videos, a few WhatsApp messages that's gone around about these vaccines. They change your mRNA, they change your DNA, whatever. And, you know, the Bible says that my people perish because they lack of knowledge.
Yeah.
So is that wisdom that is not there? No, it doesn't change your DNA. It doesn't change who you are. And then 2, there was something about is made from aborted fetal cells. There's no evidence to that. It's not made from any animal products. No, it doesn't contain egg. Just, yeah. So Michael, do you want to add to that? Anything?
Yeah, so it in terms of adverse effects, there's a lot of bad press out there, you know. So the honest truth is that we really do not know everything about these vaccines, because they've not been around for long enough. You know, we may know a lot about the flu vaccine and the MMR vaccine, but we really don't know everything there is to know about the new COVID-19 vaccines. But what we do know is that based on the clinical trial information we have, they are relatively safe. And safe doesn't mean there aren't some side effects that I will talk about in a minute. They seem to be effective based on the clinical trial data, but the true test will be, as we use it, there'll be more information on how effective it actually runs in real life, you know. But based on what we've seen, and as I said at the beginning, this is how we license drugs. All the drugs we use in clinical practice now, this is the same sort of process. You know, clinical trial data is looked at, and the drugs are licensed so they can be utilized, you know, to treat patients. It's the same processes. So from what we know, it's safe, it's effective, but time will tell because it hasn't been around for long enough. In terms of side effects, vaccines generally are quite safe, all right? They're generally quite safe. However, there are common side effects that people may have even experienced, you know, when taking the flu vaccine. You know, we talk about pain at the site. We talk about a fever sometimes. Some people complain of some aches and pains. Some people have headaches, you know, and so on. You know, symptoms that, you know, don't actually last very long and are very responsive to paracetamol. You know, there are some of those side effects. The risk of very serious side effects is very, very low. You know, I mean, if I said to you it doesn't exist, you know, it wouldn't be the true account. It's very, very low. It's actually lower than a lot of the other treatments that we use and that we're very used to right now. Okay, so the risk of very serious side effects is very low. So generally, you know, what one would say is that, you know, they are interventions that have been made available, having undergone the trials, and you know, they're relatively safe and effective for their uses.
Thank you so much, Dr. Michael and Dr. Patience. It's encouraging to hear this from you, the professionals, because there's so many people out there wondering whether to go take the vaccination or not. There you have it. It's completely safe, and a lot of work has gone into it. It hasn't been rushed. It's gone through the and to be put out there to be used. So you'll be encouraged. Go out for it with so much confidence, knowing that it is good and it's not going to harm your body. There is this misconception about nanochips and vaccination. That's one thing I've been wondering, what is it about? This nanochips, I've seen videos, people are like, oh, there's some chip in there, you'll be monitored. How can a liquid have a chip in there? So I was wondering if you knew anything about this at all.
I mean, I suspect that's come out from, so the Pfizer BioNTech vaccine, it's protected by what we call a lipid coating. You know, so lipid is essentially fatty tissue. That's what it is. You know, it's a lipid coating just to protect the vaccine. So I suspect, and this is the reason why, you know, it's handled with care. It has to be frozen at a particular temperature. Maybe people have, because we're dealing with very, very small amounts, nano sort of particles, nano, the virus, the mechanisms are very small. Proteins are very, very small. We're talking about nanoparticles. So maybe that's where this myth has come from, that you're being tagged you know, the whole world wants to know as an individual and you know, record what happens.
Yeah.
It's difficult to justify that. Some of the myths I've heard.
It's a myth, yeah. So someone's picked up that word nanoparticle and talked about nanochips.
Yeah.
It's just a normal vaccine. If you've ever had the flu vaccine before, or when babies are born and they have all the vaccines, it's just normal. And it's the liquid and it's injected, and that's what it is. And with regards to whether you're being, we both have had the vaccines. We've had the Pfizer vaccine because that was the first one that came out. So Michael had it first, and I've had the vaccine, and it's just a normal vaccine. We're not being monitored, and we're still here. And as you rightly said, Michael, people have few side effects after having a vaccine, the COVID-19 vaccine, whether it is the Pfizer one or the Oxford one, mild illnesses, but it's nothing compared to what you get if you have COVID-19 infection. And I keep saying to my friends and some of my patients who really want to know, I say to them, look, I know what COVID-19 infection can do when it's severe. It kills people. That's what it does. The vaccine would not kill you. And the other thing is, people have said, oh, we saw on TV when someone was being vaccinated and they just fainted. Yet again, we have patients who, even the sight of needle, they would pass out, and it's called, they get vasovagal during any procedure. They see blood, they see needle, that's their response to pain, and that's what it is. So that could have been what happened. Obviously, there are also people who have had severe allergic reaction in the past to anything, and they're quite, if that's the case and they're reacting to the vaccine, that's taken care of. There are precautions to make sure that anyone who is not fit to take the vaccine would not be given the vaccine. But no, someone fainting during a vaccine could be due to several other reasons, as little as the fact that they are scared of needle or pain would make them respond like that.
And talking about severe allergic reaction, there will be some people who've never had an allergic reaction in their lives who will go and have the vaccine and have an allergic reaction. Thankfully, from the data we've seen so far, many millions of doses of the vaccine have been given so far. This is it's a minimal risk, you know, just like with other treatments, you know, there is a risk of harm with other treatments as well. But the good thing is that it's minimal, it's very, very small. The risk of this happening is very small. And in terms of side effects, you know, we normally advise people, you know, paracetamol, and within, you know, 24, 48 hours, you know, they're gone in the majority of cases, So that in itself, I don't think is a reason not to have the vaccine, you know. So in terms of side effects, you know, they are recognized, and it's still constantly being monitored. And remember, millions of people have already had the dose all over the world. In the UK alone, we're talking about nearly 8 million people, you know. So in all over the world now, we have people who've had vaccine. And if it was that harmful, by now we would know that some of the side effects, you know, means that we need to stop giving the vaccine.
Thank you. Thanks for clarifying. Over to you, Shingi.
Thank you so much for that and the reassurance, because I think, as mentioned before, there is just so much information out there, and there's an information overload. And sometimes it can be so confusing to people. I've had the vaccine myself. I've had the AstraZeneca, and I just had a few aches and pains, and nothing paracetamol didn't take care of. So just thank you for clearing up some of the myths that are out there. This question is directed to you, Dr. Patience Okori. There's a lot of talk about vulnerable people and vulnerable groups, especially in particular to COVID-19. So what are the steps or some of the support that is being offered to vulnerable groups, and what would you classify as a vulnerable patient?
Thank you, Shingi. So we've got two groups. We've got clinically vulnerable patients, and then we have clinically extremely vulnerable group. So there are two different groups. People who are clinically vulnerable means that they're just vulnerable to severe COVID-19 infection by virtue of medical conditions they have, like diabetes, hypertension, and other things. But the clinically extremely vulnerable group are those that have been advised to shield. And these are people who have, I'll just mention a few of them because they're constantly on display on the government website for people to check. So the clinically extremely vulnerable group are the shielding group. And these are people who have had organ transplant, who are on chemotherapy. Those are people being treated for cancer.
Mm-hmm.
Am I right, Michael?
Yeah, that's right.
What's the other one now?
People on dialysis.
People on dialysis. And then adults who have Down syndrome have been put into this group. People who have sickle cell disease. Also, people who have, by virtue of things they've had in the past, their spleens are not functioning. These are people who have been classified as clinically extremely vulnerable group. If I've left out any group that I haven't mentioned, you'll be able to find it on the government website. But these are shielding patients, and the government there's a letter that goes out to these people to say you've been identified as this and you're meant to shield. But what it means practically for them is that they're meant to stay at home. So for those of them who have to go to a job, they're advised to work from home if they can. And for medical care that could be given at home will still be given at home. But for those medical care that they need to go out for, they're allowed to go out for those. They get some help from the government with shopping for their food and also getting their medications. So when they get this letter, they are given information on how to link with the council, with being able to arrange for their medication, being able to shop for food, and they get all of this help. So those are the practicalities of it, because some of them live alone, which means if you get a letter that says you're shielding, then how do you get food? How do you get your medications? But there's usually a link to the council website where they'll be able to. But if all of this fail, you can always contact the GP who would be able to signpost you on how to get help with getting your everyday need seen to if you're not able to.
The classification, clinically extremely vulnerable, is based on the risk of their risk of contracting COVID and also the risk of harm if they did contract COVID. So it's all in an attempt to reduce their risk of contracting COVID-19 as a disease. So the clinically extremely vulnerable group are the highest risk individuals that patients has mentioned. There's also the clinically vulnerable group, which, these are individuals who have perhaps some chronic medical conditions, people who have diabetes, they've got lung disease, pregnancy is a, clinically vulnerable group. These are individuals at higher risk than the general population of coming to harm if they contracted COVID, but not as high as the clinically extremely vulnerable group. So it's trying to identify individuals who might come to harm as a result of the disease and reducing their risk significantly. That's what it's about.
Thank you so much for that. As mentioned, that the reason for this chat room, especially today, is there's so much information, and sometimes all these terms that are used, and sometimes people don't quite understand what they mean. So thank you for that. And I'll hand over to Margaret.
And thank you, Shinji. Thank you, Dr. Patience and Dr. Michael. One of the terms that also is being used out there, which we want clarification on, is long COVID. So wanted to find out what long COVID is, what is the symptoms, and if anyone is in that phase, what routines should they adopt?
So the majority of individuals, thankfully, who have COVID will recover. And you can see that in terms of the figures we get, number of people who have positive for COVID-19 in comparison to the number of individuals who sadly have died. So the majority of individuals who have COVID-19 will recover. Now, the recovery generally for most people, by 12 weeks, most people are back to normal, okay? By 12 weeks, that's what generally happens. But there is a group of individuals that will have persistent symptoms beyond even 12 weeks, okay, and individuals who have these persistent symptoms are now being classified as individuals who may well have a condition known as long COVID. And long COVID, the symptoms are numerous, it can range from lethargy to continuous shortness of breath, headaches, brain fogginess, lack of concentration, forgetfulness. The symptoms are quite numerous. And essentially, it seems to be, a lot of work is being done about trying to identify who's at risk of long COVID versus people who are not. It seems to be something related to the virus that causes symptoms, or the body's response to the virus that causes symptoms to persist, even though the original symptoms the individual may have resolved or disappeared. So they are continuing symptoms which may or may not be the same as the original COVID symptoms that persist beyond a certain period of time, over time. And that's something that the condition known as long COVID. As I said, there is emerging evidence. Not a lot is known about it. And every day we're learning a bit more about these individuals. As you know, COVID hasn't been around for a long time, but over time, people will learn to, sort of learn a bit more about who might develop this. With regards to what you should do during long COVID,
yeah, I'm going to come into that. Yeah, with long COVID, as Michael has rightly said, it's difficult to predict who is going to get it. And it's actually been seen that some people who actually had really mild short illnesses with their COVID-19 infection ended up with long COVID. And one of the other things that I was going to add was the fact that insomnia, that's inability to sleep well, is one of it. Anxiety, people become really, really anxious and low mood. So these are also things that can happen with long COVID. So evidences are still, they're still looking into why people are getting and who is getting it. But there are clinics that have been set up across the country for people who have long COVID to be referred to. Obviously, because it's new and people are still getting COVID, it's slightly not as quick as it would be. But if the advice has been that if your symptoms are persisting more than 4 to 6 weeks, you might want to speak to your GP to be able to say, I still have these symptoms. Is there a chance? Is it possible I have long COVID? And if it stays beyond 12 weeks, people will be referred to the long COVID clinic where they would be, they would be looked at and all the treatment or support that will be made available to them. Some people have actually, I think there was one severe case I heard of where this lady lost the ability to walk, really, because they get muscle fatigue, they get aches and pains still. So it's so varied, but if you're not sure, one of the best things to do, or the first thing to do, is to speak to your GP. But as you rightly said, Michael, 12 weeks is usually, most people would be back to normal by 12 weeks. So if it's persisting beyond that, then speak to your GP.
And with regards to what you do about it, I mean, there's no established treatment at the moment, for long COVID. So what I would say is, things that promote your general health can continue in that way. Your eating, your habits, exercise and so on. Just try and promote a general well-being, during that time, because at the moment we don't know, we're none the wiser with regards to how to deal with long COVID.
Thank you so much. I think the encouraging thing to know is that there is support out there. So if anyone is going through that, don't suffer in silence. Contact your GP and you'll be referred further. And also make sure you're doing the normal things you would do to maintain a good well-being, and you'll be okay. Over to you, Shinge.
Thank you so much, Dr. Michael and Dr. Patience Okori. It's so insightful, and then I'm learning so much. So our final point really to discuss this morning is a lot of people, due to COVID and everything that's happened, they've been affected socio and economically as well, and mentally. So a lot of people are living in fear. So could you just maybe give us some tips or educate us on how anxiety can affect your physical health and your mental health, and just a few tips on how we can counteract some of those things?
Yeah. We know that anxiety on its own could also make people to begin to develop physical symptoms. It's been a very stressful time for a lot of people, for most people, for all of us, really, since the pandemic. And it's not unusual to have people who would develop generalized anxiety disorder or just severe anxiety with everything. But one of the things we have to think about is anxiety on its own would begin to sometimes make people feel unwell, because anxiety will cause you to secrete corticosteroids. Am I right? And sometimes that on its own would be, it's a vicious cycle. Basically, it goes through the brain, stimulates the wrong hormones and all, and people will become unwell. So it's our general well-being is very important. Our emotional and mental well-being is really important at this time. So whatever things people do to help allay the anxiety, it could be that you're able to have support on the phone through your friends, or you do some mindfulness, which you can do online, or you could do online, or via referral through the GP as well. Again, if you're feeling unusually anxious, then you can contact the GP to speak to someone to be referred. But there's a lot of online help resources out there that can help people deal with anxiety. There's also support that you get through your community. We know that you have to limit social contact, or social contact doesn't have to be physical, it could be on the phone. So that's the new way of reaching out to people on the phone, via Zoom, via videos. So you can, if that makes you feel better because you feel that you're in touch with other people, you could do that on the phone, you could do that via video. But most of all, if you really feel that this anxiety seems to be impacting you badly, or you think this possibly needs a bit more treatment than normal things, then you have to speak to your GP, who will signpost you to how to get help or refer you. Michael, is there anything that you want to?
I think it's to not to suffer in silence, because some of us, culturally, we showing any weakness is a weakness in itself, So there's plenty of help out there, wherever you are in the world, there is help. Speaking to your neighbor about a particular problem, or speaking to a friend or family does help and is very, very therapeutic. So rather than suffer in silence and think you're invincible, it's important to accept any weakness, especially when it becomes to mental health. And with COVID, with going against, being countercultural, going against normal practices, telling people not to meet with people, I mean, it's bound to affect mental health. People, as a result of ill health, it's affecting their employment situation, it's affecting money, finances, all of this have got a knock-on effect on one's mental health. But, my advice would be, do not suffer in silence, do not suffer alone. Try and share the issues, and you won't begin to imagine how therapeutic reaching out it can be in this sort of a situation. And just before I finish, I sense it's coming to an end, is just to say, for Black and minority ethnic groups, particularly, people who live in the Western world, there is you're disproportionately represented in terms of COVID-19 and severity. People who you're more likely to have severe disease, more likely to actually contract COVID. But in terms of vaccine uptake or acceptance, ironically, that we Black and minority ethnic groups are less likely to accept the vaccine or to take the vaccine up. Now, if we're saying that the vaccine is protective, and that's the only way, because COVID-19 does not have a cure, as I said, the medicines that have been developed only reduce your risk of severe disease or go into the intensive care unit. The only way is to vaccinate people, and to vaccinate as many people as possible. And for a treatment that is quite effective, I mean, some people don't ask questions generally around the flu vaccine, or a lot of the people don't ask questions, majority of people, around MMR, has a good uptake, or smallpox, that was eradicated because of vaccine technology. So if you do believe in treatments working, then the vaccine will be the one way to invest your time and effort into understanding why you should accept it. And we don't know everything that we need to know about the vaccine, but we certainly do know that COVID-19 affects Black and minority ethnic groups disproportionately, and not just in terms of risk, but also the severity. So that's some food for thought to bear in mind.
Amazing. Thank you so much. It's good to know that there is support out there. I was actually going to ask for your final thoughts, and I believe, Dr. Michael, you've already shared that with us. So, Dr. Patience, do you have any final thoughts, please?
The final thought will take the good vaccine. Take the vaccine. Take the vaccine. COVID-19 kills. The vaccine reduces the severity and reduces your risk of contracting this sickness that is likely to kill. So take the vaccine. That would be my final message. If we didn't take up the polio vaccine, you will still have people limping around because that's what it costs. It costs disability. If we didn't have the smallpox vaccine, the yellow fever vaccine, we will still have been dying of smallpox and yellow fever. So this is another vaccine. Take COVID-19 vaccine. That would be my advice. And this is the only light at the end of the tunnel that we have right now. So
thank you so
back
much.
to normal, we need the COVID vaccine.
Thank you. The only light at the end of the tunnel is a vaccine. So take the vaccine. There you have it. Any final thoughts, Shinga? I know you wanted to say something and I stepped in.
No, I think both Dr. Patience and Dr. Michael Okoro, I was going to ask something in terms of people that are disproportionately affected, but Dr. Michael jumped in and he's
Sorry.
You're more than welcome to. That's why we have you here. So thank you. No final thoughts, but it's just been a really insightful time. And thank you so much for taking the time to join us today. It's been really insightful.
Pleasure.
Pleasure.
Pleasure. Yeah.
And thank you too for having us.
It's a pleasure. I will echo that. It has been an eye-opening discussion for me. I'm not in the medical field, and at times there's a lot of information out there and it can be so overwhelming. Thank you so much for taking the time, Dr. Patience and Dr. Michael. We know you're very busy, but you said yes to us. Thank you so much. We really, really appreciate this. And may God richly bless you. And we've come to the end of today's discussion. It's been very insightful. I've learned a lot, and I trust you've learned something too. Hosea chapter 4, verse 6 says that for lack of knowledge, my people are destroyed. I believe this discussion will save the lives of many. It's our prayer that the knowledge you've acquired here today will help you navigate this challenging season successfully. As I said earlier at the beginning, do not keep this to yourself. Spread the word, share this with family and friends. It will bless a lot of people. Until we come your way again, stay safe and God bless. Bye for now. Bye.